who is at the risk of getting osteoarthritis? There are several factors that contributes to the development of osteoarthritis in man. Number one is non-modifiable risk factors, which means there are factors which we have no control, which we cannot modify due to various biological reasons. The first one is age. Age is an inevitable process. You cannot do anything. At best, you can delay the process of aging by adopting good lifestyle, good food, good thinking, keeping minimum exercise to the body, and have a delightful life. You can prolong the various types of symptoms that appear in the body, like graying, dehydration, etc. But that you can only control to a very limited level. Aging is an inevitable process. Two things man cannot control. One is aging and another is death. The second is gender. You have no control. You are born male, you are born female. You have no control. There are certain things which will happen to male. There are certain things which will happen to female. That is an inevitable biological consequence for which you have no control. Biology of the women, biology of the men are totally different. Lifestyles are different, habits are different, and that will have a strong impact on development of various diseases. Then genetics. Genetics means we have no fairly good knowledge about the genetics, the genes. Many diseases are transmitted from one generation to another by genes. Diabetes is a very important disease. It is inherited from one generation to other generation, and that is also you cannot control. But then diabetics, now scientists say that by appropriately adopting right lifestyles, you can prolong the onset of diabetes. A person supposed to develop diabetes type 2 at 40 can prolong 50 or 60 by adopting right measures, but one day you will get the disease. Genes are responsible for expressing various symptoms, expressing various type of proteins and other components, which causes a lot of diseases, a lot of issues to man. But if it is a single gene-oriented property, we can regulate it. But most of the cases, the properties are contributed by a number of genes. In such cases, no gene manipulation is possible. Then we come back to modifiable risk factors. Modifiable means these are acquired habits which we produce in our body by our own habits. So if you regulate and control them to a large extent, you can prevent osteoarthritis development. First and foremost, among both male and female, common is obesity. Obesity can have a lot of problems, right from nervous system to heart to kidneys and liver and all the things. The basic symptom, obesity, and responsible for development of arthritis is overweight. The body weight, your legs fail to support. Invariably, the leg get lot of strains, the nerves get strained, the muscle gets strained, and the blood vessels gets strained. All contribute to degeneration. It affects the circulatory system. Tissues need blood. There won't be proper inflow. They get weakened. As a consequence, the toll is on the joints. Immobility is very common among obese people. So one of the major organ that affects obese people is the knees and hip. While knee is fairly treatable and can be controlled by drugs and other methods, hip problems are very difficult. Hip transplant also is a very, very difficult process. So you must understand that you control your weight, regulate the weight, but don't go for starvation. If you go for starvation, uncared, uncontrolled, lot of deficiency takes place. That will lead to development of so many other diseases for which you get victimized. Then injury is very common. Football players, tennis players, sportsmen, they fall very frequently. They will not recognize immediately the problem. The injury happens, some local treatment takes place, and you feel cured. But that injury will be there sometimes hidden, and after a time it develops in the form of arthritis and becomes uncontrollable. You will have to go for treatments. The only aspects for sportsmen is they are so energetic, they are doing exercise, their rehabilitation and tissue degeneration, they are is much fast compared to an aged person. Then infection. Lot of microorganisms can get in. Today there are organisms which can affect specific joints and parts. They habitat the regions, they eat away the tissues, and you get problems. So microbial, but to a large extent we have excellent antibiotics and antimicrobials, and if you do appropriate culture of blood, identify the organisms, you can destroy them. So microbial infection can be completely controlled. Then occupational hazards. Certain job needs certain postures for a long time. Bench job, sitting for a long time. And there are specific jobs which requires hard work for certain part of the body like hand, leg, etc. That eventually makes those regions weak, and if you don't lubricate them properly, so please understand that human body is a machine. A machine needs lubrication. A machine has to be lubricated at several points, but our machine we don't lubricate. We don't know that such a thing is very much needed. Fortunately for man, there are a number of chemicals and molecules and proteins our human body develops. They are sent to the particular region, and there they themselves are lubricated. That's the wonder of human body, which very few people know. But they also have limitations. Sometimes they fail, and then the disease starts. So occupational hazards associated with the postures, they can be easily contained. Take rest after a time. If you are sitting too much in a table for a long time, you get out for 10 minutes, walk around, come back and sit and do some kind of movements. Don't sit for a long time. So if you do like that, there will be blood circulation in the region, that wastages accumulated there which create the pain will be removed. That's an excellent way to contain disease. There is also people sitting in the shops near the cash box for a long time without doing anything. They may not get time. Eventually develop back pain and hip joint problems. So that's another issue. And one of the modern problem with spondylitis associated is soft buds. People don't know, when you sleep in cushioned soft beds, strain develops in the back and spondylitis develops. It is a form of arthritis, and such people are not expected to sleep on. In fact, sleeping in a hard surface is an excellent remedy for most of the back pains. In the past, our forefathers had no problem because Most of them were sleeping on the floor. With the advent of modern amenities like cots, beds, and soft cushion things, the diseases also become very rapid. Back pain is very common among almost all the people. And then diseases. Certain diseases carry with them the problems of arthritis.